Remarks, the good member from the 5th Legislative District, Representative Callan.
Thank you, Mr. Speaker. I don't have to tell you how difficult COVID-19 pandemic has been. As a firefighter, you've seen it firsthand. You know the impact and how personally it's devastating it has been for so many. That is especially true for our children and our youth. Even before the pandemic, we knew that our behavioral health care system was stretched far thin. Now, during the pandemic, we've seen it reach a crisis state. When you're a parent that has a child that's not eating, and you're being told that it's going to take months before they can get the care that they need. When you have a child that is too afraid to go to school, and you're being told, sorry, in your county, there are no Medicaid slots available for you. Call back next month. That is a system in crisis. In Washington, we need to do better. I think we can do better. As co-chair of the Children and Youth Behavioral Health Work Group, I've had the great honor of working with over 300 stakeholders during the interim to talk about this problem. I've had the opportunity to work with and discuss with our healthcare providers, our state agencies, our counties, our education systems. I've had the opportunity to hear our families tell their stories, bravely share their experiences. The work group, through all of its stakeholders, provided a recommendation of all the work that we could do this session. Several of those are going to be budget requests. There's a couple of bills that you're going to see on the floor, this one being one of them. And they address the immediate crisis and what we can do today, and they talk about what we can do tomorrow. This bill is about what we need to do for the long term. It establishes a landscape analysis to really understand what services are out there, from promotion and prevention, all the way through intervention, crisis, recovery, and sustained well-being.
The good member has 30 seconds left. Please conclude.
So with the landscape analysis and a strategic plan and a vision to make sure we know where we're going, I ask for your support to make sure we can get there. Thank you.
Remarks. The good member from the 5th Legislative District, Representative Callan.
Thank you, Mr. Speaker, and thank you to the good member from the 39th. Our partnership and work on the Children and Youth Behavioral Health Work Group is evident. As I mentioned just when I spoke earlier, there would be a couple of bills coming before you, and this is one of them. We can do all the work in the world in the legislature to try to make our behavioral health care system better, but if our families don't know about it, their children still won't get the help they need. That's exactly what this bill is about. It's about providing the resources to make that happen, to spell out the technical ease of the legislation, and to put it into practical use for our families. I appreciate your consideration, and I ask you to vote yes.